If you're over 60 and you've noticed your morning wood isn't what it used to be, there's a good chance the way you're sleeping is quietly strangling your erections every single night. I'm not talking about stress or low testosterone. I'm talking about something so simple you'd never suspect it. The position your body is in for 7 to 8 hours while you're asleep. Most men have no idea that lying the wrong way compresses blood vessels, pinches nerves in the pelvic region, and slowly trains their body to stop producing those automatic nighttime erections that keep everything healthy down there. And here's the kicker. It's fixable starting tonight. I'm Dr. Laura Stone, men's health and urology expert. Make sure you hit that subscribe button and turn on notifications. Drop a comment below with your name, age, and where you're watching from. Here's what we're covering today. First, which sleeping positions are secretly sabotaging your erections. Then, the nighttime habits that protect your prostate. And finally, a simple bedtime routine you can start tonight to see improvements in as little as 7 to 14 days. Stick with me because we're about to change how you sleep and how you perform. Let's start with the best position most men completely overlook. Sleeping on your left side. When you sleep on your left side specifically, you're doing your cardiovascular system, your digestion, and your penis a massive favor. Sleeping on your stomach compresses the nerves and blood vessels that run through your pelvis and down into your genital area. Imagine lying on a garden hose for 8 hours straight. Nothing's getting through. The same thing happens to the arteries that feed blood to your penis when you're face down all night. When you lie on your left side, you take pressure off the vena, which is the major vein that returns blood to your heart. Better circulation means more blood availability when your body triggers those automatic erections during REM sleep. Studies show that left-side sleeping improves cardiovascular function, and your erections are entirely dependent on your cardiovascular system. Here's a simple technique. When you lie on your left side, place a firm pillow between your knees and another small pillow under your waist for lumbar support. This keeps your spine aligned and prevents your pelvis from twisting and compressing those critical blood vessels. I've worked with men in their 70s and 80s who made this one change, and within 2 to 3 weeks started noticing morning erections again. One gentleman hadn't woken up hard in over 5 years. After adjusting his sleep position, he got his morning wood back in less than a month. No pills, no supplements, just better mechanics. Now, let's talk about the positions that are quietly destroying your erections. The two biggest culprits are sleeping flat on your back and sleeping on your stomach. Sleeping on your stomach is probably the worst thing you can do. When you lie face down, your entire body weight presses down on your pelvis, compressing the pudendal nerve, which is the main nerve responsible for sensation and function in your penis. It also squeezes the internal pudendal artery, one of the primary blood suppliers to your erectile tissue. You know that dead leg feeling you sometimes wake up with? That's called paresthesia, and it happens when pressure cuts off blood flow. If it's happening to your leg, it's also happening to your pelvis and your penis. Over weeks, months, and years, this chronic deprivation can lead to tissue damage and loss of elasticity. Sleeping flat on your back creates another problem. For men carrying extra weight around the neck and chest, lying flat causes the tongue and soft tissues in the throat to collapse backward, blocking the airway and triggering snoring or sleep apnea. When your airway is blocked, your oxygen levels drop. Low oxygen means your body pumps out cortisol and adrenaline instead of testosterone. Studies show that men with untreated sleep apnea have significantly higher rates of erectile dysfunction. Your penis needs oxygen-rich blood to function. If you're choking yourself all night long, you're starving your erectile tissue. So, what can you do? If you sleep on your back, prop yourself up at a 30 to 45 degree angle with a wedge pillow. This keeps your airway open. If you're a stomach sleeper, try putting a tennis ball in the front pocket of your pajama shirt. Every time you try to roll onto your stomach, the discomfort wakes you up just enough to shift back onto your side. Now, let's talk about nighttime habits that protect your prostate. One of the simplest but most overlooked habits is emptying your bladder completely right before you lie down. I mean, taking your time, relaxing your pelvic floor, and making sure every last drop is out. When your bladder is full overnight, it presses directly against your prostate, restricting blood flow and triggering those frustrating middle-of-the-bathroom trips that destroy your sleep cycles. Interrupted sleep means interrupted REM cycles. And REM is when your body produces the testosterone and nitric oxide you need for erections. Taper off your water intake about 2 to 3 hours before bed. Get your hydration in during the day and early evening. Here's something most men never think about. The temperature of your bedroom has a direct impact on testosterone production. Your testicles need to be slightly cooler than your core body temperature. If your room is too hot, anything above 70 degrees, you're basically cooking your hormone factory all night long. Keep your bedroom between 60 to 67 degrees. Let's talk underwear. Tight briefs or restrictive boxer briefs compress blood vessels and trap heat exactly where you don't want it. When you go to bed, either wear loose cotton boxers or sleep naked. Giving your genitals room to breathe and stay cool overnight protects testosterone production and keeps blood flowing freely. Here's the science most doctors never explain. Your penis doesn't just randomly get hard at night. Those erections are your body running a system check. Healthy men can have 3 to 5 spontaneous erections during a full night's sleep, each lasting 20 to 40 minutes. These are maintenance erections. Your body is flooding your erectile tissue with oxygen-rich blood to keep it healthy and elastic. Your body produces the majority of its testosterone during deep sleep, specifically in the first few hours after you fall asleep. But you have to be in deep, uninterrupted sleep for this to happen properly. If you're waking up every hour, your body never completes this process. You end up with lower testosterone, less sex drive, and weaker erections. During hours 2 through 4 of sleep, your body produces the highest levels of nitric oxide, the master molecule for erections. Nitric oxide relaxes the smooth muscle tissue in your blood vessels, allowing blood to rush into your penis. If you're snoring or breathing poorly during those critical hours, your nitric oxide levels plummet. Sleep quality beats sleep quantity every single time. 6 or 7 hours of deep, uninterrupted restorative sleep will do more for your testosterone and erections than 10 hours of garbage sleep ever could. Let me give you a simple bedtime routine. About 30 to 45 minutes before sleep, warm up a cup of milk and stir in 1 teaspoon of raw honey and 1/4 teaspoon of cinnamon. The honey keeps your blood sugar stable. The cinnamon enhances blood flow, and the warm milk contains tryptophan, which helps produce melatonin. Pair that with a 5-minute breathing exercise. Sit on the edge of your bed. Breathe in slowly through your nose for a count of 4. Hold for 4. Then exhale through your mouth for 6. Repeat for 5 minutes. This activates your parasympathetic nervous system, lowers your heart rate, and increases oxygen saturation. More oxygen means better nitric oxide production. Before you drift off, do a gentle pelvic floor massage. Lie on your back with knees bent. Place one hand low on your abdomen just above your pubic bone and use your fingertips to apply gentle circular pressure. Work across the lower abdomen and down toward the inner thighs. This stimulates blood flow to the pelvic region and relaxes tight muscles. Here's the bottom line, gentlemen. Your erections aren't gone forever, and you don't need a prescription to get them back. Sleep on your left side with a pillow between your knees. Avoid stomach and flat back sleeping. Empty your bladder before bed. Keep your room cool. Do your breathing and massage routine. It's not complicated, it's not expensive, and it works. If you found this helpful, hit that subscribe button. Drop a comment telling me what changes you're going to try tonight. Share this with any man who needs to hear it. Your body wants to work for you. You just have to stop getting in its way. Thanks for watching.